So stroke is a cessation or an interruption of blood flow to the brain. As y'all know, blood carries oxygen to all the tissues and is extremely important for the brain. So any interruption of blood flow to the brain can cause devastational outcomes. There's two types of strokes. There's an ischemic stroke and a hemorrhagic stroke. An ischemic stroke is where there's an occlusion of blood flow to the brain, so blood just does not flow to the area that it needs to. This can be related to other medical conditions like high blood pressure, high cholesterol, smoking that cause narrowing or plaque buildup. The other type of stroke is a hemorrhagic stroke, and that's where the vessel that carries blood to the brain actually ruptures and you bleed into the brain. That can be associated with an aneurysm or the other risk factors that we talked about. So the most common symptoms of a stroke is going to be some sort of paralysis or lack of motor function, speech function, or things of that nature. So sometimes a patient has a facial droop. One side of their face may drop, they can't lift an eyebrow, they have slurred speech, can't lift an arm. But oftentimes slurred speech is a huge red flag for a stroke or an interruption of something that the body can no longer do. I can't lift my arm, my face is drooping, I'm having a hard time talking. So the main risk factors, especially for ischemic stroke, are going to be controlling other metabolic medical conditions like controlling diabetes, stop smoking, lower your cholesterol, get regular exercise, lose weight, and be aware that people that have those conditions are at higher risk and perhaps screening for stroke and taking prescription medications in order to avoid those outcomes. Now, when it comes to a hemorrhagic stroke, sometimes there's a family history of aneurysms, but also controlling blood pressure is very important for a hemorrhagic stroke. So the immediate treatment for a stroke is if we suspect an occlusion, an ischemic stroke, oftentimes we have to immediately give blood thinners to try to resolve this and restore blood flow to the brain. That would be the immediate thing, stabilizing the patient, make sure that they're able to breathe and secure their airway and there's no other complicating factors. The reason that's important is because a stroke can have different effects depending on where in the brain it occurs. So posterior brain might be more of a motor or a muscular movement or breathing. An anterior head could be speech. So we want to restore blood flow as soon as possible. Long term, again, would be controlling the risk factors of stroke, such as cut back on smoking, control the cholesterol, diabetes, things of that nature. Now, a hemorrhagic stroke, which is there's bleeding in the brain, immediately have to image it and find out how much bleeding there is and also try to repair it if it's surgically repairable. Sometimes we observe it and we avoid blood thinners to those patients because we don't want it to get worse. And depending on where the bleed is, sometimes there have to be a surgical evacuation of the bleed and repair of an aneurysm. And based on that, monitor the patient for recovery and make sure that the stroke does not progress. So after a patient is stabilized from a stroke and deemed stable for discharge, we often order physical therapy to help maintain their muscular strength, help reestablish any coordination they may have lost. Sometimes speech therapy, where some patients need to learn how to speak again. And then there's occupational therapy, which teaches a patient how to basically do activities of daily living, dress themselves, brush their teeth, use a fork and a knife. Many patients don't need that. They do well, but some do if they've had a big stroke. Long-term supportive care for patients who have stroke is to try to get them back to a normal life as much as their body recovers, and again, control the risk factors that cause the stroke.